everyone. We are live at the Neurological Center in Fayetteville, Arkansas. And we are going to take the opportunity today to talk about our treatment system. We have some patients in the audience here that we're not showing. And we will be taking questions from you guys that Kaylee behind the camera will be reading to me. Please do us a favor and drop us a line and tell us where you're watching from. We get questions all the time in here, and it's a pretty busy clinic, and we don't always get to answer those questions. So today is all about that, discussing our treatment. Most of our patients here have complex regional pain syndrome, so that's most of our audience too, but not everybody does. I think if I'm looking over at my audience, we have an audience of complex regional pain syndrome. This is Tammie.
I apologize with the face. I just choked on a piece of chicken. I'm okay. I'm in the right place to survive this.
She had to eat her meal in 2 minutes.
Yeah, don't do
That's
that.
your lunch today.
Yeah, that was a very bad decision. I won't be hearing that again.
This is Hippopotamus, our in-house therapy dog. And this is Bryce. I call Bryce my lieutenant. Bryce and Tammie are both neuromuscular re-education therapists, which is one of the big pillars of treatment that we offer here. So together today, the three of us will be taking questions and talking about our treatment. I want to quickly go over, a lot of you have read my book. If you haven't, it's on Amazon. It's called Putting Out the Fire, New Hope for CRPS. And we talk about our treatment system, but it has changed quite a bit since I've written the book. And that's always going to happen because we will not be happy until we hit 100% success rate. And I always say we grow by our difficult cases. So, you become so obsessed by the people that you cannot help. And so that's where our focus is. We're looking for systems and treatments to add to our system to help those people is how we've developed the system. We're doing so many different things all at once to target central nervous system health. And then we do it all together in this roughly 12-week program. It's not 12 weeks for everybody. It's 12 weeks for most people. And doing all those things together, we get people to the other side. Now, I need to stress that we don't truly treat syndromes. We balance the central nervous system to promote health from within so that the body can heal from the inside out. The difference with our treatment system and what is out there in the rest of the world right now available for syndromes like complex regional pain syndrome and Ehlers-Danlos syndrome is that most of those treatment systems center around controlling pain. Our philosophy is basically, we get that, we understand that, but there is so much more that you can do for people. That's the UPS guy. I think you guys are hearing in the background. We're just winding down for lunch. Rather than dampening pain, interrupting pain signals so that your body can calm down from within, you can leave our environment and now you can have additional surgeries, you can have dental work, you can have needle draws, and you do not have to live wrapped in bubble wrap, always guarding against the outside world. So, Bryce, I'm going to have you talk a little bit because this is something you often mention about how we strengthen people to go back out in the real world.
Yeah, it's more strengthening through just function, getting muscles to play the role they were designed for. When you're talking about pain or, what we see in chronic pain, it's something that's sustained for a period of time. It's not like it's an athletic injury or the wrong step from a week ago. It's years and years of pain. So when you experience pain, muscles protect, muscles shorten. And when it's that way for a certain period of time, they're just going to pattern that way. Strong muscles, a long and loose muscle, we got to get that muscle to lengthen through stress so it can lengthen and shorten and absorb more force rather than transferring that force into the affected areas or other areas. Talking about EDS or CRPS, and especially the full body cases, it's much more than just working my affected left ankle, it's also the tension they're holding up in their upper thoracic and shoulder and occipital bridge region. There's a lot more we do here to treat the body as a whole. But in a nutshell, that's all it is. It's providing stress from an external source, and then using that external source as an external brain to train your brain how to move through stress or the stress of the condition itself and the pain that the patient's suffering.
So, Bryce, a question. I'm just going to ask questions for you guys because I know it's on your mind. A question that I get a lot is, how is your system different than physical therapy? Because I've done physical therapy, I've done PT.
So we're looking to create, or I guess recreate, neurological pattern. We all have the same musculoskeletal system underneath us. Those muscles play a specific role. What we need to do is find where that muscle is breaking down, where the signal is, I guess, not reaching, and turn that signal back on, getting the muscle to perform for us. It's hard to replicate that in physical therapy. Now, not every repetition is going to be the same. Here, using the modality that we use and our expertise in training, we're able to get one rep to equal about 250 reps in physical therapy. That's the amount of information that the nervous system is absorbing. So if you can go to physical therapy and do that same movement 250 times the same way, you're probably going to get a change, but that's just, theoretically it's possible, but, in reality, especially when you put pain into the mix, that's pretty impossible. But we do that here in one rep. Now, the first rep might not be the cleanest, but through a series of prescribed movements and repetitions and sets, we're going to get that to happen. And what the patients are going to experience is their movements have freed up. It's easier to move. And then from that external source, we provide more stress, which is going to tighten up the patient or be along the same lines of stress from pain. And then we're going to learn how to relax the muscle, move through it, use it for its intended purpose. And, with that, the pain will drop.
Let me tell you guys what that looks like in practice. We have patients sometimes running in parking lot, around cans, running backwards. And we had a patient here from Belgium, Victorine, if you happen to be watching this. She wanted to get back to volleyball. She had an ankle fracture on crutches for 5 years. And she didn't just want to be in remission. She wanted to play volleyball again. This was the love of her life. So Bryce had her jump from a chair about this high onto concrete, hooked up to the machine over and over, knowing that she had to go home, carry this grimacing in the background, so that she could withstand that impact. Rain has been impact for more than a year now.
Yeah, we obviously didn't start there on treatment one.
Well, you don't want to stare at it?
You got to learn how to move first.
Yeah.
But then she wanted to get back to activity, volleyball. Well, you got to jump and land in volleyball. So to learn how to jump, we had to learn how to land first. So that was the point in the altitude drops from the chair. But yeah, each patient, has their own goal in mind for what they want to resume. And, we got to alter the treatment or the last half of that treatment or quarter of their treatment in the neuromuscular education to kind of fit their needs and wants.
Recently, Tammie, we added oxygen.
You might hear the hissing in the background.
Yeah, sounds like Darth Vader. And you guys, this is not hyperbaric chamber. Can you talk a little bit about how that works?
Okay. So if you're familiar with hyperbaric chamber, you're using pressure to push the blood through. This, we're using your own mechanical system, so your heart, your lungs, to help push oxygen through your body. And we have a pretty cool system in there. It actually is oxygen deprivation. So what we do is we get your heart rate up doing a movement, might be a bicycle. Bryce might have something for us to do during our neuromuscular education. What we do, we get the heart rate up, so we make sure that the blood is flowing well. We have a pulse ox, and we check how the saturation level is in the body. We want it to be like 97 to 100%. And then once you're feeling, I guess, at your peak, we'll actually do a drop, and we'll make the heart rate stay up. You'll keep performing well, and then it's 14% oxygen, so we're going to take you to like 10,000 feet elevation. You're going to stay there, and as you're there, we're going to watch what your saturation level of your oxygen is in your system, and once it drops about to a 92%, then we're going to give you back up to about 95% oxygen. And we keep a cycle going with that. So by doing that, areas, so let's say with Dr. K, she had something going on with her foot here. She may have pain in there, and the blood in that area maybe hasn't been turned over in a while. So by doing this, we're forcing your own body to work itself and to do its normal homeostasis, come down, flush that area out, and then your lovely liver and kidneys are going to do their work. So there's a detox with that. Usually just increases your maybe your bowel movements, maybe halitosis, and sweating. But it's pretty non-invasive. Being in there is equivalent to doing maybe 2 hours of cardio exercise, in about 15 minutes.
And we've seen some big breakthroughs with that treatment.
We really, really have pain levels after doing something. And for a lot of people, they might be nervous going in and knowing that they're going to get their heart rate up and they're going to be moving. Typically, they've been working in neuromuscular before they go in there. So we make sure that the body can function properly before doing that. And then when they come out, the pain drops have been pretty impressive with that. For sure.
You guys, if you're watching, or even our audience, if you guys have questions for us, I know with me especially, patients will say, I just wish I had more time with you because I have all these things I want to ask. So now it's your time. If you want to send in questions to us, Kaylee will read them to us and we'll answer it about our entire system. Bryce, what about, people always wonder, how painful is this? Can I tolerate this? I already have CRPS. How am I going to do this?
It's not the same sensation as your CRPS. P word can become a swear word, and we want to use something like, intensity, the intensity of the treatment. But I'm sure everybody here that's been through it can relate that it's not the same pain as their CRPS. It's much more tolerable, and in fact, you're moving through it. Whereas if you felt the same level of intensity in neuromuscular education as you do on the pain scale, you're not going to move at a 9. Okay, you're at a 10. You're going to kind of be immobilized and want to curl up in a ball. And that may happen in there in the beginning, but through repetitions, we're going to get the body to learn to relax, kind of harness that parasympathetic system and clean it up through repetitions, and now we can move through it and the intensity drops. Then we increase the intensity again and we move through it, the same process. Body kind of tightens up in the beginning stages. First couple reps, we learn how to just move and open up, and then after that, bang, 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 now we're moving. Turn it up again, the same thing. It is important to get to that level of intensity, though, that your body kind of wants to shut down at. That's pretty much the same level of stress out in the real world that you move at and then compensate, and that compensation creates pain. So if we can replicate the same compensation pattern in a controlled environment, learn to move without that compensation at the high level of stress, our body's adapting to change. And we can do that in real time right now. It's not going to take us walking a block, running a mile, going up a flight of stairs to have us try to figure out what compensatory actions are leading to the pain. It's just a flip of the dial.
Tammie, when does someone ring the bell?
Oof, that's a hard question. When they're ready.
When they feel that they've reached their level of recovery?
Yeah, usually when people ask us when they come in, like, I don't think I'll ever be able to ring the bell. I think it's something we typically hear when someone comes in. And then as they go through, they start to realize that it's not just about being pain-free. It's about understanding the body. It's about feeling like you have your control back. It's controlling that voice in your head that's saying, you're making a bad decision. If you do this right now, everything's going to be horrible. It's about recognizing that and being able to slow it down, realizing what you do have control over, and just adding to it. And knowing life's a roller coaster. There's normal people problems. That's what we're trying to get to. You know, you might wake up in the morning and feel a little something here or there. Normal people problems. That's what we want. So when someone can usually recognize that and be like, may not be a zero, but you know what? I feel like I have control. I feel like I can take these tools and move on. They can ring that bell, which happens to be right there.
And there's a process to make sure that the patient's ready too. Once we're sustaining lower pain numbers, we'll bring in tests for the patient to go through and activities. And if their pain doesn't return, odds are the things we're going to bring them through are going to be a lot more stressful than what they want to do. And if they're not going to feel pain and compensate and feel pain during that test, what out there is going to cause it?
Right.
There might be some maintenance that they need to continue doing to maintain the changes that they saw here. But, you know, it's probably kind of tough for the people to see online that, you know, they see all the success stories and see the people leaving happy with smiles and getting their life back. What you don't see online is all the hard work that they got to put in here. You know, 12 weeks is it's kind of a period of time.
All
You know,
the
and
tears.
to be,
Okay.
it's not a one appointment and then you're done for the day. You're in appointments all day long, and a lot of it's stressing your body out. But the ability to recover from all that too is you know, the main thing. But it's a lot of work to come here every day and to go through and get zapped in those neuromuscular.
Marty is
education.
agreeing. It's not a spa treatment, guys.
No, and you know, there's a lot of ups and there's a lot of downs. So you activate a muscle and get it to lengthen out, and it hasn't done that in 10 years, that muscle's going to recoil and get really, really sore afterwards. We're used to it. We know what to do when that happens. Everybody's going to feel that.
It's not our first rodeo.
No, but you know, we keep pushing forward. You know, it might be a day or two that you don't feel the results that you did the 2 days before, but the day or two of recovery, then it'll come back and our body will feel fresh and not sore. And then we go hard and intense again and get those results going. But it's a process.
Do you have a question?
Yeah, so Bryce, you kind of just touched on this, but someone wants to know, is the treatment inpatient and how long does it take?
Yeah, it's here at the center. As far as how long it
Outpatient.
takes,
Can you talk a little bit louder?
yeah, as far as how long it takes, you know, again, if this happened a week ago, probably not going to take as long as it did if it happened 30 years ago. You know, the body needs a certain period of time to adapt to change, 30 to 90 days. That's why our programs are, you know, 12 weeks.
12 weeks. But not for everybody. Sam's out there. I think this is Sam's 15th week, right? Sam was full body. And so that's been quite a journey.
The Albertina was probably one of her biggest things to overcome too with her.
If you've been through multiple surgeries too and have a ton of scar tissue, we need to eliminate that. That might take a little bit longer than somebody that does not. You know, so there's factors that come into play there, but
I think the emotional factor too. I think some people don't give that enough understanding. Like they're like, oh, but this hurts, but they don't realize the emotions that are attracted with the injury or where it is. And that's where Dr. Lucas, of course, really comes in with his treatment.
So really quick, I want to just go through our treatment for you guys because you may be watching this thinking, what do they do? I have a technique. I see a patient roughly 3 times a day, every single day they're in here, where we do vagus nerve stimulation. It's a nerve that comes out here. It controls inflammation in the nervous system, and it controls the GI tract. So what happens is if that nerve stops communicating, which is the case for pretty much 100% of CRPS patients, their GI tract will start failing. The patient will just know, I cannot digest food. I'm getting nauseous when I eat. I'm not going to the bathroom. and then they go to a GI doctor that does not understand how that is connected to CRPS. So that's my piece of the puzzle. Dr. Lucas works with emotional stress, how that impacts the central nervous system. Dr. Hannah Lee looks at blood work. Often patients will come in with CBCs, with differentials, different blood work, like a forensic scientist, looking for clues that we've learned to recognize with a very large patient pool of CRPS patients that we've treated. So there are certain things we've learned to look for, like chronic Epstein Barr infections. If we put a patient on the neuromuscular re-education and their pain is super high, then we start investigating and we look for chronic viral infections that need to be treated, because that is constantly affecting the vagus nerve. We have scar tissue treatments that use sound wave technology, which is pretty darn gentle to very effectively break up scar tissue, because if you have scar tissue anywhere in the body, you can have scar tissue in your shoulder affecting your ankle, because the nerve communication moves through the body like a wave from cell to cell. So just like a river, if you create ripples in that wave, it's going to affect your healing. So we have to address scar tissue. We have magnetic resonance energy, a machine called Magnosphere that we use to target specific tissues like nerve tissue, to really set the table to make the patient more ready, their nervous system, to accept treatments. We have the oxygen treatment now. We have neuromuscular re-education. Next door, we work with the brain with EEG equipment, measuring brainwave activity and making sure that you're not in a state of fight or flight, where your nervous system thinks you're being attacked all the time and it's super vigilant. Also to set the table for you to respond to treatment. Am I leaving anything else?
I think that's it.
How many of your patients have rung the bell?
Yeah,
Oh.
I don't know.
I have no idea.
A lot.
We cannot make claims as to, yes, we help 100% of people, but what I can tell you guys is we just completed a patient poll with all patients that have rung the bell for about 8.5 years and then sooner. I have 2 patients that graduated 8.5 years ago, and our ongoing success rate fell at 80.2%. And we're pretty darn proud of that.
It was 80.4.
Is it 80.4? Am I leaving 0.2 out?
I don't know. I have to double check the stats, but I think it's 80.4.
All right, 80.0 to 80.4% success rate. And I'm looking in the audience at some of our patients that have been to so many different programs and have tried so many different things. I'm looking at you, Marty. How many years have you had CRPS, remind me?
7 years.
7 years. And you tried a bunch of
I
stuff.
tried anything that was out there.
How are you doing?
I'm better than I have in 7 years. Much better.
Did you? That's another question I get all the time is people will look me up and invariably will say, you're not even a real doctor, you're a chiropractor. So I get that a lot, and I understand that it's a big stretch because the public's perception of what chiropractic is that we pop backs and people have neck pain and back pain, and that's what we do. But we go to school steeped in the philosophy that the nervous system is amazing, that the body can heal itself, that the body is a whole, so you don't just treat parts, you treat the entire body, the entire patient. And if you put a really good system together to remove nervous system interference, you really can see miracles with what the body can accomplish. And we see that here all the time. It is pretty rare to hear about someone that went into remission from complex regional pain syndrome. Almost kind of a unicorn. You hear about it every now and then when those stories are out in support groups and on Facebook, they are met with a lot of skepticism. And I'm here to tell you that we have seen a lot of success stories in this building. And I've gained so much respect for what the body can do in the case of complex regional pain syndrome. So I don't want you guys to have that label and then go on Google and look it up and say, this is an incurable condition, can't ever get better. Don't focus on that stuff. Just focus on how amazing your body is, support it, and it can get better. Your body can heal itself. No one else can do that for you. We're supporting your nervous systems to do that.
Everybody's got the same blueprint, so if somebody's gonna get success, everybody should get success.
If you think with the lady in her 60s, so she came through the program. She didn't have much hope. Remember, she dragged her leg behind her when she came in. She left here and she went whitewater rafting 3 months after she was out, about that 3 to 5 months. She might be able to correct me. And then she actually tore her rotator cuff last winter doing something. And she's like, it's not a big deal. CRPS didn't come back. It's just a rotator cuff issue. I'll fix it. Which is pretty amazing because that's a pretty big injury to get afterwards. And she's good. She's extremely happy. She's still active. On a lot of the pictures that get posted, you'll see her just posting something lovely.
There's been numerous patients that have come in a wheelchair and have walked or ran out.
And the sunglasses and the guarding. Yeah.
Light sensitivity.
Yeah, it's a big one. The sound.
That brings me to a good point, you guys, in case you haven't heard this. There is a reason you guys are so sensitive to light and sound and vibration. When the central nervous system is so affected, your cranial nerves are extra diligent and really not functioning correctly. So you cannot process any nervous system stress, and your cranial nerves, I always say they're the front door to your nervous system. So what you sense, where you are in space, your balance, what you're hearing, what you're tasting, what you're smelling, what you're seeing. And so those nerves are really affected. And that is part of what we do here together with rehabilitating the sensory nervous system, is to get those nerves to start healing so that the sunglasses can come off. And a baby crying when you go to the store doesn't send you over the edge. But a lot of people, when they start, are very, very fragile in how much sensory input their bodies can withstand.
Hold a lot of that pain upstairs.
Yeah. So for our audience here, do you guys have questions for us about the treatments, about how stuff works? People will often ask us, when I leave, what's going to happen if I have to have a surgery? What's going to happen if I fall? We've had some pretty, what I call exit injuries with people that are out in the real world. We've had metal being taken out of bone, removed.
And the screws.
Screwed up, I'm imagining, drilled out of the bone.
Yeah, so leaving little holes there.
Yeah.
Something that's unnatural. So if the central nervous system wanted to react, it's finding a reason to try to shut you down. And yeah, that was pretty amazing. Being nervous about getting the hardware out. And as she got healthier, the hardware she had in her foot actually was working itself out. Because when they put it in, they thought that she wouldn't be doing anything. She would just be in a wheelchair, and that was it. So when they did the surgery, they're like, you're fine. And then when it started working out, they're like, oh, we need to get rid of that because you weren't supposed to be able to do all the stuff you're doing now. So she got it out, super nervous, came back. Within a few weeks, she was back up doing all the stuff she'd done before. Well, I don't think she'd done it in 7 years or maybe a little bit longer. But yeah, she was back up to full speed again. It was pretty neat. But she was nervous, but she knew that it was worth the risk for her to get her life back.
We have a question back there.
I was just wondering if you could kind of expand on the two words that keep running through my mind are coping versus healing. So is the objective to train your body how to cope and then healing comes along, or is it to heal? I heard the 100% success rate goal. So can you expand on that?
Certainly, our goal with every patient is to send them out into the world to go live really a life that's better after CRPS than it was before, because now you have a new appreciation. But to be able to run, to be able to go to the gym, to be able to eat sugar and drink
alcohol, to go to work,
Yeah,
to be able to go shopping,
pick
to be
up
able
their
to
kids.
drive a car, brush your hair, have a shower, and not feel like there's glass coming out.
A pet peeve of mine, I always hold back. You guys, I'm not good at holding back, but these.
Nothing for that.
No, I'm not known for. It's not my strength. So many of our patients have been to pediatric pain management programs. And I'm just going to say that I don't like them. I understand that a lot of people do get some results with it. But to me, the approach that if you cannot handle a loud noise, so now we're going to expose you to loud noises over and over and over again, so you just learn to cope with it, is not truly getting to the bottom of the problem. Why are you sensitive to loud noises? We have a young patient here. How long has she been sick for?
Since she was 13, I believe, and she's 19.
I think she attended 2 programs, and in one of those programs, a very well-known program, they hit her with pool noodles over and over again so that she would get used to that sensation. And it doesn't make sense to me. It's just crazy. That patient is sensitive to a reason. Help her central nervous system to recover. Rather than saying, oh, you don't like being slapped in the face, I'm going to slap you 2,000 times. And eventually you're just going to get used to it and give up. Kieran, I think you've been to somewhat of a similar program in the United Kingdom as well. It's possible to regain function, but we just have higher standards here. My passion, our passion, because my staff is every bit as passionate as I am, is to have patients get their quality of life back. We're so emotionally invested with each patient under our care. It takes us a little while to bond, but when you come in, we get to know you, we get to know your case, we get to know your family, we know what your goals and hopes and dreams are, and so it's our goal for you to heal, not to cope with pain. We were not born supposed to be coping with pain.
Okay, I have a few questions. The first one says, I had a bad reaction to electric stim. It reactivated things for a while after 2 treatments. Is this a big part of the treatment here?
There's different types of electrical stimulation. The one that we use, actually allows for an eccentric muscle contraction, which is the lengthening of a muscle, whereas many just focus on concentrically contracting a muscle. So let's say you have pain in your elbow, and to treat that pain, you're given, say, a TENS unit. You sandwich the elbow and you turn it up and you feel the muscle contract. Well, odds are all the muscles around that elbow are tight anyways because of the pain that we're under. They're protecting. But now we're going to introduce a stimulus that's going to tighten those muscles up even more. Now we might feel a little bit of relief because it's really blocking some pain signals and bringing blood flow into the area. But as far as identifying why that elbow is causing to be in pain, it's not going to do anything for it. Whereas ours is going to pinpoint the origin of why the elbow is in pain. We wouldn't treat the elbow, but we would find what's not doing its job or where there's a break in that neurological chain of communication that's preventing muscles from doing their job. I feel on ours a concentric contraction, but with the appropriate prescribed movement, that concentric contraction is going to turn into an eccentric, and that's then going to provide relief from the painful area. So, there's a reason why that person asking the question felt pain. That's probably it. Whereas ours is going to not treat the site of pain, just like we don't treat symptoms here, but treat the origin of pain.
The nervous system does not guard against the electric current that we use. That's the beauty, the pattern behind this current. It's not like anything else on the market today. It's not like a TENS unit. All these other things out there. it's a very, very unique pillar of our treatment. You had another question.
Yeah, someone wants to know if Epstein Barr or Lyme is something that can affect recovery.
Yes, it could. Although, I'm thinking of some really famous cases. We've had ring the bell, little Australian patient that have had some of those problems. So there are obstacles for sure. They need to be handled. We have protocols for those things. It may slow us down a bit, but my gosh, there is a very high percentage of complex regional pain syndrome patients that deal with chronic viral infections, and even some of our staff members have dealt with some of those issues. So yeah, it's a complicating factor. Does it stop us? Absolutely not.
Once you calm down all those other systems, can handle that infection much better. It's not always a flare that's going to prevent activity.
You have to think it's like a pond with moving water. Mosquitoes cannot lay their eggs in it, but the condition of the body is perfect to encourage those chronic viral infections. Your immune system isn't kicking in. Your central nervous system runs your immune system, and if that's not working, then you've got stagnant water, and now you've got leeches and mosquitoes and Bryce, this is your department, fishing and dirty parasites,
bad algae.
Yeah, just flourishing in that bad environment. So if we change the environment, if we make your environment clean and strong and communicating with your central nervous system, now you can fight off infections like you were supposed to do.
Sort of all the forces out there.
Marty, did you have any other electric stimulation before coming
I
here?
tried a 10 unit and it put me into stratosphere pain.
Yeah.
And this does not. Well, it does for a moment, but then the pain drops considerably. And my mobility is up 75% with using the Neuromuscular Education.
That's the first, it's a mouthful. That's the first thing that really changed for you, if I remember correctly,
Yes.
is your mobility came back.
Within the first 2 weeks.
Another question, I don't know why, but I just thought of this for some reason. It has nothing to do with what you were saying, is if your treatment is so effective, why doesn't everybody know about it? So I have spoken for RSDSA. They certainly know about our treatment. We work with Burning Limb Foundation in Dallas. Things have changed quite a bit since my book has come out, but it is slow going. The status quo is so strong, and doctors all across the world have this template. If you're lucky enough that your doctor knows what CRPS is, spinal cord stimulators, opioids, ketamine. This is the accepted treatment. We're certainly working on our Google ranking. We're working on our new website. We're putting videos out on Facebook repeatedly, but it's still just a drop in the bucket compared to how well known all these other treatments are. Although I do believe that we're getting more and more exposure, and word of mouth is getting out there. One of my first questions I always ask incoming patients is, how did you find me? And no one ever has said, oh, it was really easy. It was, oh my gosh, it was midnight one night. I'll never forget. I was eating peanut butter on toast and I was on the internet and you popped up.
Or I think one of my favorite was, it was a mother with a daughter, and the mother she was overwhelmed, and she went to a parking lot somewhere to go cry so that her daughter wouldn't see it, makes me tear up thinking about it, and she just started hitting YouTube, and she saw you, and then she said, that's it. And then they figured out how to get here. It wasn't the easiest thing for them to rearrange their schedules, but they did it. And they were here for that. Yeah.
She's in remission.
Yeah, she is. She sent me a picture of her walking through the park with her boyfriend. And she
Hi,
was
Gabby.
full body. Yeah. Hey, Gabby, I miss you.
Gabby from California.
Yeah.
Okay, guys, we have a couple people that are wondering if you can touch on insurance coverage for our program.
Yes. So insurance companies, of course, I'm a chiropractor, and so that is the category that I fall in. Our treatment program is definitely outside of the box. It is not typically how chiropractic is delivered, because you'll go see your chiropractor maybe once or twice a week for 12 visits, whatever it may be, and then they cut down. This is a whole other category. A lot of the treatments that we offer are just simply not recognized by insurance companies to be effective. And so the short of it is there may be some reimbursement from insurance companies. We do not file to insurance companies for that reason. And unfortunately, for that reason, it is a self-pay treatment. We wish it were different. Did you have another question, Kelly, or just several people asking that one single? Go ahead.
What do you say to the people that essentially live far away out of North America? Do you have something to say towards those guys that, it's a big deal to move, and as you say, change your schedule, get involved in a culture that you might not be used to? Just one thing, I saw your map, and I feel like most of it is out of North America, potentially. Right?
Yes. It's a brilliant question. We get that all the time, and it's really funny. We'll have someone ask a question, let's say from Minnesota, and say, "Oh no, I can't do it because I'm in Minnesota." And we're thinking, we've got people here from Australia. Unfortunately, at this time, we're the only center in the world that offers our program. I know this because I'm the one that developed this program, inch by painful inch. And so my staff, even if I could take my system and go to a clinic and say, here's the system, here are the machines, my staff has picked up on the ground experience, literally sometimes with their heads on the ground, watching feet move, to truly understand complex regional pain syndrome and fibromyalgia and Ehlers-Danlos syndrome. And we've treated hundreds of people. And so that experience cannot be replicated. My staff are independent. They are fantastic. They're passionate. And for that reason, unfortunately, at this point, you're going to have to get on a train or a boat or an airplane and come to Arkansas. There's just no simple solution for that. It's not an easy thing, especially if you're coming in from Australia. But what I would say makes it easier is our patient care coordinator, Anna, is fantastic. We have hotels, we have Airbnbs, we have private rentals, a whole network of people here that we can put you in touch with. Our patient base here is fantastic because you have people that have been here a while. They have seen people come in and go, and then when they get better, there's this sort of older brother, older sister system where they take people under their wing. It is not a waiting room where you're like on an elevator and you're not talking to the person next to you and everyone's reading magazines. We've got people playing cards and people going out over the weekends together and doing things. You're going to step into a very warm and loving community. And so even if you're here alone, you're still making friends with people that understand what you're going through. They're going through the same system. And so you have to travel, but we're worth it.
And I think the other thing is your system is customized. Like no one person's going to come through and you need to do this and this and this. You're really good at understanding what they need, who they also need to be with, which is pretty neat. Most places won't do that. They're like, this is your therapist, you're stuck with them, but sometimes you need to switch it up. And sometimes they need a little bit more of this, a little less of that. And I think for your program, that's what I do appreciate.
A puzzle. Every patient's a puzzle.
Every patient's a puzzle, and you don't give up.
You guys are complicated puzzles.
Very complicated.
But we're competitive. Bryce, would you say you're a little bit competitive, Tammie?
Mildly.
Do you like losing?
No. No.
So it's all about winning. And if we have a very complicated patient case in front of us, we like to figure that out. We don't like sending people home that we can't help. And figuring out, placing a therapist with a patient is a little bit like a dating game. You have to understand both personalities and what they respond to, and then you see how it goes. And sometimes we have to switch up. So we do that. one thing we very much encourage in here is that we become attached to our patients, emotionally involved. How many times have you left the clinic to go play basketball with a patient or go fish?
Yeah, there's definitely been times for that. And, you know, a lot of that comes down to the work in itself and incorporating some kind of test that you got to go through to make sure you're ready to graduate. So,
Yeah.
to see that happen is very fulfilling. No cookie cutter approach though at all.
No. And I think that's another question that comes in. It's like, well, I don't like this. I don't think I can do this, or I can't be touched, or I can't have this. That's fine. You're gonna put that puzzle piece
I like
together as needed and go with that. So don't be scared when you see videos of someone doing wall squats and Bryce is there, come on, you know, or you see us outside going for a walk or something else. You're like, I could never do that. Don't limit yourself. We're not going to limit you. We're going to encourage you to grow. We're going to figure out what the limitations are together and overcome them.
Yes. Yes.
I have a few questions.
Go ahead.
So, about what week do we get to Bryce? I know it varies, but is that towards the end?
No, not every patient is going to work with Bryce, and not every patient should work with Bryce because Bryce is very demanding, and that's not always a good fit with everybody. And so I cannot think of a therapist here that has not brought the patient to a bell. And so as long as you're making progress and your pain is dropping at the rate that we expect it to drop, you may just stay with the therapist where you are.
You know, in that regards, we meet every week and we talk about everybody, you know, and we all give our insight on, you know, possible changes to, you know, get a greater result. So, I mean, we come together, we talk about all you guys.
Yeah, we do. We really, because we need everyone's input, especially with the neuromuscular education, to know what's going on and what's worked here and what did you find with this, so that we can all, because with our personalities and with our different backgrounds, we're really able to kind of come together. And Bryce, having the most experience with all this, definitely is our leader with getting our program going as it is. But each individual therapist has their own little bit of pizzazz to bring in for sure, and strengths.
All right. Do a lot of patients when they graduate get off? Are they off their pain medicine? I know that's a goal of mine.
Yes, pain medication. We get that question a lot. That's a great question. Do I have to stop my pain medication before I come in? No. First off, I'm a chiropractor and I cannot legally advise on that. We do have a medical doctor in town that's fantastic, that understands the condition that we refer to. We prefer that you come in and we can compare apples with apples. Because if you just abruptly drop all your medication before coming in, then you come in and say the first 2 weeks, well, I'm not responding. Well, we're not comparing apples with apples. And people don't put those puzzle pieces together. But once we start noticing that your pain is dropping, we're going to refer you out. Obviously, the goal is eventually for you to get back to normalcy, which does not include taking pain medication or muscle relaxers every single day of your life. And so we prefer that you go through that change here while we're holding your hands. And that way, if you have withdrawals, which we see a lot, and bumps in the road with that process, we can handle that while you're here under our care. And then we send you out.
I have a question over here. It's, does a patient's age make a difference in recovery rate?
Not really. Do you guys think? We're not, there's this template or this golden belief, it shouldn't be golden, but you have to catch CRPS in that first year or you're just out of luck and things are not going to work for you, whereas you're joining infusions or whatever it is. We have not found that to be true for our system. What is the most long-term case we've treated? Can you guys remember?
33 years.
33 years.
Actually, the gentleman with muscular dystrophy had it 26 years.
Yeah, and he was walking.
Yeah, we got him out of the scooter. He's walking. He's retained all those changes.
10 treatments in, he was walking 400 feet.
And he wanted to.
Yes.
Like he wasn't being forced, he wasn't being pushed. He was like, I can do this. Yeah. I think we were more nervous.
Our patient from Houston, was she in her 60s?
Yeah, she was. I feel like she's gonna come at me. I think she was mid-60s.
We're not saying names.
No. Yeah, I believe so. And there was also, yeah, she was.
Our youngest patient, 6 or 8,
Eight.
8 years old.
8 years old.
Kids blow me away how well they do in neuromuscular education because it's a lot. It's taxing. Your mind has to be in it, and so we've had amazing results with really, really young kids, and obviously we get super emotionally involved with our little ones.
Children are really hard.
Yeah. All right. If we don't have any more questions, if anyone wants to pop a question in really quick, you may be able to go eat a few more pieces of chicken.
And not choke this
And
one.
not
I just
choke it
feel
down.
It's so embarrassing.
All right, I want to close with a message. Please go ahead and share. If you have friends, if you have family members, go ahead and share. So word of mouth will get out there. We are on Facebook all the time. I'm very hands-on with it. And so if you put questions in afterwards underneath, we'll try and go ahead and answer as many of those as we can. The number one thing I want you to walk away with today is to hold on to hope, to hold on to your hope with everything inside of you. Do not let anybody take that away from you. You have to keep fighting because it's worth it. On the other side of this is your life, and it's waiting for you. Also, do not forget to share this in your support groups. Post questions for us after. Follow our Facebook page. We put up a ton of videos. Whenever we have a bell ring, sometimes it's private, but most of the times we'll have those live. And most of our incoming patients have seen a ton of videos before they ever come in to keep that hope alive. So thank you so much, everybody, for watching. Thanks to our audience. We appreciate your time, and this was really a treat to interact with you. Have a wonderful day.